Good morning. I want to welcome you guys all to an open enrollment session for 2018 where we will be discussing our benefit changes as well as what's staying the same and all of our benefits offerings for 2018. My name is Jessie Lehman. I'm the benefits coordinator here, and I will be discussing health, dental, and vision today, while Chelsea Wickham, who is our retirement planning coordinator, will be going over financial benefit offerings for you. We will be utilizing our website for our presentation, so hopefully you've all had a chance to go out and look at it and review the information and tools that are out there for you. There are 22 days left of open enrollment. It started November 1st, and you have until November 30th to make all of your changes for 2018. Steps 1 and 2, we've already hit on the dates, and you're here for a session. So we will be concentrating mostly on steps 3 and steps 4, which is know your plan and then how to make those changes for 2018. This explanation point here, that is something that everyone should take note of. Those are points to look at. If you are a Merit Ask Me employee, you must enroll in a health and or dental plan, depending on your situation, if you want to continue coverage in 2018. Also, for all employees, if you want to contribute to a flex spending plan for 2018, that's something that you have to enroll in each and every year. Moving down to know our plans. So for 2018, if you are new to what's called a self-insured plan, you may have been hearing it or reading it in all the documents that we have been sending out. So self-insured, what does that mean? How we utilize our plans can affect our premiums. So what we bring in for premiums have to cover our claims costs. That's what self-insured is. So the higher claims we have, the more premiums we have to cover those claims. There are certain things that we can do to keep our claims costs down. So this video goes over, again, what self-insured is, and then as well as some things that we can do to help keep those claims costs down.
Hi. Over the next few minutes, you will discover what self-insured means, how it works, and how your choices influence your medical costs. This is Gina. She is a new employee at the University of Northern Iowa, and she is eligible to enroll in one of the university's self-insured Wellmark health plans. While reviewing and comparing each plan on the UNI Human Resource Services website, she notices the university also contributes substantially to the health plans to cover her and her children's medical needs. Gina decides to enroll in a family plan. The next month, Gina notices the health insurance premium deduction from her payslip. The following summer, Gina found herself visiting her doctor's office because on a walk, she had forgotten the old saying, "Leaves of 3? Let it be." Her doctor confirmed the rash was from poison ivy. An electronic prescription request was sent to her Hy-Vee pharmacy. Before leaving the doctor's office, she paid her low copay. On the drive home from her pharmacy, Gina questioned, what was the total cost of her doctor's visit and prescription? Was it only the 2 copays? A few weeks later, this was answered when Gina received her explanation of benefits from Wellmark. Gina was shocked to see the doctor's charge for her visit. She was astonished to see the network savings negotiated by Wellmark. But one column remained on the EOB. It was labeled "Amount Paid by Health Plan." Gina wondered what this column represented. Then, Gina remembered what she had learned during new hire orientation about self-insured health plans. Self-insured means employee premium deductions go into a university-managed health plan account, instead of being sent directly to Wellmark. Also during payroll, the university's employer portion of the premium moves to the same health plan account. Because the plan is self-insured, the health plan account pays the amount in this column. Which means, the account pays the medical claims, not Wellmark. Gina also remembered what the benefits team had shared about how her choices impacted her costs and future premiums. They highlighted 4 examples of how members can take ownership. The first way: use in-network providers in Iowa. Wellmark negotiates lower rates with in-network providers to save you in the health plan account. Iowa providers are often 35% less than out-of-state providers. Next, know your options. Understand your options and the entire cost of a service before you schedule an appointment. The ER is an expensive choice when not an emergency. Choose wisely. This impacts the plan costs and premiums. The third way you can take ownership is to select generic prescriptions. When possible, selecting a generic over a brand name will save you in the health plan account. CVS and Hy-Vee negotiate with drug companies for even greater savings. Lastly, use UNI well-being services. Participate in employee-free biometric screenings and free flu shots rather than going to your healthcare provider. These services are also a lower cost to the health plan account. Since the health plan account is a pool of employees' premiums, and the university's contribution, Gina understood. Her choices impacted everyone. Could she alone impact our health plan account? No, not possible. Collectively, she knows all members must be wise consumers to maintain a healthy account. To learn more, visit our website.
So as you can see, there are several things that we can do in order to keep our claims costs down. So utilizing a generic when possible, utilizing providers inside the state of Iowa, and then also utilizing our well-being services. That being said, flu shots, there is one last clinic today and then during the well-being fair that you would be able to receive your flu shot. So the clinic today is over in the Student Health Center, and then attending the well-being fair, you can also receive a flu shot then. Moving down our page to know your health plans. I'm not sure why this is going in and out. But so we have 2 self-insured health plans that you can choose from, our UNI PPO and our Blue Advantage. So what we have on this side of the page is what's new. So for 2018, there have been plan changes, and that is how we pay for certain services on our plans. That doesn't mean that providers have changed or networks or services. It's how we pay for those services that has changed. New for 2018, premiums have increased on the PPO plan, and that is for the single, the family, and the shared family option. And when I reference shared family, that means that 2 UNI employees, so you and your spouse, if you both work for the university, are eligible, in benefits eligible positions, can qualify for that shared family option. The amount that the university also contributes to the health plans has increased as well, but the premiums for the UNI Blue Advantage plan has stayed the same from 2017 to 2018. Copays for both office visits and specialist visits have increased on both plans. The annual medical and prescription max out-of-pocket has increased for both plans. Emergency room charges have changed. The PPO plan, it's a copay and then a co-insurance charge. And then for Blue Advantage, it has increased from $50 to $100 if you're utilizing the ER. And then now the product selection penalty rule now applies to prescriptions received on the Blue Advantage plan. This has already been in place on the PPO, and we'll go into a little more detail on what that actually means a little bit later in when we're going through the health plans. On the right side of our page here, we have tools to help you choose and tools to help you use. So concentrating first on tools to help you choose, we have our plan comparison for the year. And as you can see at the top of this are the 3 columns, and in the middle is the PPO plan. The PPO plan is a nationwide network and around the world. It does participate, 200 different countries participate in this plan, so you can use it internationally as well. There's an in-network and an out-of-network, but what we want to point out is if you receive services in the if they're considered out-of-network, that doesn't mean that you're no longer covered on the plan. That just means that because you're outside the network, you might pay a little bit more for being outside the network, but you would still be covered. If you were previously on the Plan 3 Plus or the Iowa Select plan, this PPO plan is most like those plans in terms of the network and the range of providers. So again, nationwide network. The Blue Advantage plan, notice it only has an in-network column. That means that you have to be in-network in order to be covered on this plan. The network for this plan is Iowa only. Outside of the state of Iowa, the only thing that would be covered would be accidental injuries or emergencies. If you're previously on the Blue Access plan, then the Blue Advantage plan is most similar to that plan in terms of the network and services. So something to keep in mind when going through this document. The premiums are listed here, and these are listed as the 1/12 amount. So if you receive your premiums in 12 paychecks or 12 benefit deductions, and this is the amount that you would see. If you receive them in 9 or 10 benefits deductions throughout the year, you would then just take this amount times 12 and then divide it by that 9 or 10, and that's what you would see come out of your paycheck. Newly process that we're doing is everyone will be defaulted to pre-tax deductions, meaning that we will take your premiums out of your pay prior to your full pay being taxed. And Chelsea will go over that in more detail and what that means and what savings that presents to you a little bit later in this session. So as you can see, the premiums for employees are listed in bold. So for the PPO plan, it's $21 for single, $357.55 for family, and then $178.80 for that shared family option. For Blue Advantage, there is not a premium for single, so it's $0, $188.85 for family, and then $20.10 for that shared family option. Next on the listing is the deductible. So for the PPO plan, there is a $350 deductible for single and $700 maximum per family that has to be met for certain services. And on the Blue Advantage plan, it's $100 per person and $200 per family. Co-insurance percentage, so it's 10% in network for PPO as well as Blue Advantage, and that would be applied after the deductible is met on the plan. And there is no lifetime benefit maximum on either of the two plans. On page 2, it goes into networks again. So again, national and international providers on PPO, and then Iowa only for the Blue Advantage. And a note here is that for the Blue Advantage plan, you are required to designate a primary care physician, or also known as a designated personal doctor, for the plan. So that would be required at the time of enrollment. You have to list that doctor. It cannot be like a full clinic. It has to be a specific person, their name listed. And also for anyone else you're covering on the plan. So a spouse or any dependents, everyone must have a designated personal doctor. You can use the same doctor for everyone, or if you all have your own doctors, then you can list them separate, or they would be listed separately, and you could list different doctors for each person. Women can list 2. They can have a general practitioner and an OBGYN. So that is an option as well. For preventive care, it is covered at 100% on both plans, and that would include your routine physicals annually, OBGYN exams, well child exams, immunizations, etc. Both plans cover a routine eye exam, so something to keep in mind if your previous plan didn't cover an eye exam, or if you're enrolled in a vision plan, or you want to make changes to your vision plan, then just keep in mind that your health plan, if you do enroll, does cover a routine eye exam, and that would be for you and anyone else on your plan that you're covering for your family. Office visits, urgent care, and virtual office visits. When I say virtual office visit, we utilize Doctor on Demand. Those are all copay services. So the copays are listed there at $20 for the PPO plan and $15 for Blue Advantage. The specialists, as I noted on the website, that has increased for 2018, so 40 for PPO and 15 for Blue Advantage. Chiropractic care, so those are copay services. You can go to the chiropractor at unlimited visits on the PPO plan, and a difference between the PPO and the Blue Advantage is the Blue Advantage, it does limit you to 12 visits per year, unless you get a referral from your primary care physician. Once that referral goes through and it is approved, then those additional visits would then be covered, and you would be charged just that copay for that service. Allergy testing, shots, and serum are detailed here if that applies to you or your family. Both plans have excellent maternity care. The physician's charges, the office visits, and the hospital charges are all listed here. and how they differ or are the same between the two plans. Inpatient and outpatient hospital and physician charges are a 10% coinsurance after that deductible is met for each plan. Emergency room, as noted, has changed for 2018. So on the PPO plan, you would owe a $100 copay, then 10% of the bill after your deductible has been met. On the Blue Advantage plan, if you go to the ER, it would be $100 copay. Other covered services such as physical therapy or private duty nursing are coinsurance services after that deductible has been met. Moving on to prescription drugs. So the tiers on the prescription drug plans are the same for each of the plans. So for a generic, it would be $10. For tier 2 preferred, it's $30. Tiers 3 and 4 is $50. And then specialty, $100 for preferred and $200 copay for the non-preferred. If you're wondering how or where your drug fits into a specific prescription, fits into a tier, you can utilize the BlueRx Complete formulary listing here. It has a searchable field at the top. You enter in your prescription name and then it'll bring it up. It'll tell you what tier it falls under, as well as other information such as if a generic is available or if prior authorization is required. One question we've been getting through our sessions, we know our video does reference CVS and Hy-Vee as pharmacies. You are not limited to those two pharmacies. The information we're trying to get out is that those two pharmacies do negotiate with drug companies for lower costs and lower prices for prescriptions that benefit you as well as our health plan. But it also may be cheaper if you go to a different pharmacy. So we're just encouraging employees to shop around and make sure that they are receiving the best possible deal for their prescription. So under the tiers there, you will see the definition and what it means for the product selection penalty rule. So I brought that up as a point on our webpage for something that's new for the Blue Advantage plan. So what that means is that when you choose to receive a brand name when a generic is available, Wellmark will pay only what it would have paid for the equivalent generic prescription. The remainder of that price will then be owed by you. So it's when you're choosing a brand name when a generic is available that they will only pay for what they would have paid for that generic. So that is new to the Blue Advantage plan, but has always been or has been on the PPO plan previously. There's also a mail service order service for prescriptions. So that would be if your prescription applies, then you can have your prescriptions mailed home to you. It would be a 3-month supply, but you would only owe 2 monthly copays. So you would experience a savings if you took part of that service. You can find out if your prescription qualifies by visiting our website, and we have a link to that on there. Both plans have a medical and a prescription max out of pocket. As we mentioned, they have increased for 2018. So for the medical for PPO, it is $1,750 per person or $3,500 maximum per family. And on the Blue Advantage, it's $750 per person or $1,500 maximum per family. For prescriptions, it is now the same on both plans at $2,600 per person or $5,200 maximum per family. Once you've met the max out of pocket for either of these two, they are separate, but once you've met that, all covered services or prescriptions would then be covered at 100% for the remainder of the year. Your coinsurance, your copays, and your deductibles all apply towards your medical max out of pocket. Your premiums do not, so that is something monthly that comes from your paycheck. On the next page, we've included a glossary for you, and if you've already received this packet in the mail, that's great. We have mailed home information to you and your families about what is new for 2018, and then this document's in there. So this is just a glossary that you can always reference if there is a term that maybe you've forgotten what it means or you're not sure how it applies to your plan. On the next page, we have our points to consider for when choosing a health plan. So this has the two health plans side by side and some of our most frequently asked questions and how they apply to each of the plans. On the top section of the document, or on the top section of this page, is the in-network, and then the below is the out-of-network. For example, significant number of medical providers in Iowa, so that would be both plans. They have about 98% of physicians that are considered in-network in the state of Iowa and 100% of hospitals. So as long as you're receiving coverage in Iowa, it would be pretty hard to find someone that wouldn't be considered covered on either of the two plans. significant number of medical providers nationwide, which would include Mayo Clinic in Rochester, that would only be the PPO plan. So if you're on the Blue Advantage, then you cannot receive covered services while at the Mayo Clinic. International coverage, just the PPO plan. National and international coverage when an emergency, so that would be both plans. You would be covered if it was an emergency. Coverage for chiropractic care and routine eye exams, both plans have those, offer those coverages. And then does not require referral for in-network providers, both plans. So as long as you are staying within the network, you do not need a referral. Out of network, so nationwide coverage again, the PPO plan. Coverage with a guest membership, so that would be Blue Advantage. So while on the Blue Advantage plan, if you or a family member is going to be outside of Iowa for at least 90 days, you can apply for what's called a guest membership. This is coverage outside of the Iowa network for someone that's been living outside of the state. A common example of this would be a child that decides to go to school outside of Iowa. So then you could still maintain your Blue Advantage coverage, and then you just have to get that guest membership for them. Doesn't cost you anything extra. It's just notifying Walmart by calling the number on the back of your card and then having them set you up with a guest membership. That person would also have to elect a primary care provider wherever they're at outside of the state, and Walmart can help you do that and find a list of providers as well. Does not require a referral for out-of-network providers. That's only the PPO plan. Prescription drugs with a product selection penalty rule, both plans. Requires a designated personal doctor or that primary care physician. That would be the Blue Advantage plan. Coverage for medically necessary services, that would be both plans, and both plans accept the doctor on demand virtual office visit services. The final page to this document gives more definition to some of the things we've already discussed. So one question we get is, okay, I'm on the Blue Advantage plan, I'm outside of the state of Iowa, what is considered an emergency? So this definition is taken right from our coverage manual. So that's placing the health of the individual or a pregnant woman, the health of a woman and her unborn child in serious jeopardy, the serious impairment of a bodily function, serious dysfunction of a bodily organ or part. So any of those would be considered an emergency. We often get questions on who can you designate as a primary care physician. So it'd be family practitioners, general practitioners, OBGYNs, pediatricians, etc. And again, women can choose two. Other providers that are not designated personal doctors, an example would be a chiropractor. And that listing is there. And then all other providers would then be considered specialists, such as a cardiologist would be an example of that. The image on the right-hand side of the screen gives a little more definition, a visual definition to our network. So you'd see the PPO plan is that nationwide, the Blue Advantage is the Iowa only, with the overlapping being that coverage for international or national and international coverage for those emergencies. So far, are there any questions on the differences or on the two health plans available? Yes.
For the deductible, you had talked about the PPO, the per person, is that the same as the single, or is it like by the family? Is it the deductible? Do you get what I'm saying?
Yep, so her question is why do we say per person and then per family? So you can be on a family plan, and the deductible that you have to meet as an individual only will go up to that single amount. So $350 or $100. So you yourself, once you've paid that $350 or $100, you've satisfied that single deductible, and your family would be working towards meeting that family deductible. So you can satisfy it as a single, even if you're on the family plan. And that also applies to the max out of pocket. You can meet the max out of pocket as a single while being enrolled as a family, and then your covered services for the rest of the year would then be covered at 100%, while your family works towards meeting that family max out of pocket.
What's the percentage covered after you meet your deductible?
So then you would move to that co-insurance. So after your deductible is met, so it depends on the service, but in-network is a 10% co-insurance.
Okay.
So, yep, good questions. Roxy?
If you go to the emergency room, and it's $100, it used to be if they
So that's right, for the Blue Advantage plan. So if you are at, so
Copay for the PPO is also waived.
So the copay on those plans would be waived if you were admitted, and then it would move, so on the PPO plan, you would pay that co-insurance and the deductible, and then on the Blue Advantage, it moves to that co-insurance inpatient hospital stay. Yeah. Yes.
I'm kind of simple. The insurance that I have now, I want to know what's compatible to. I had Blue SS, Blue Advantage is the same basic insurance as the Blue Advantage.
It's the most similar. So one of the major, both are Iowa only plans. So the networks would be the same, but one difference is that you do have to designate that primary care physician when on the Blue Advantage.
Okay, what about, go down to the first one. No, go down some. I'm sorry.
No.
See when I say how simple I am?
No, you're fine.
That right there, it says shared family coverage, then it got 178, and then on the other side is 2010. What's that?
Shared family is when you and your spouse both work for the university in benefits eligible positions, then you can qualify for that lesser premium rather than the family plan. So you get a discount if both you and your spouse work for the university.
That's only if you have two people working.
Yep.
Otherwise, it's 178, 180.
188 for the family under Blue Advantage and 357.55 for the PPO.
So you telling me the Blue SS, what I need to apply for is the one in the middle?
I would never tell you which plan you need to apply for, but the plan that is most similar to the Blue Access plan is the Blue Advantage.
Which one? Okay, good. That's all I need to know.
Awesome. Are there any other questions? Okay. We can move along to our other tools that we have here to kind of help you make those health plan decisions. So we have the 2018 Blue Advantage and PPO Summary of Benefits Coverage document. So those go into a lot more detail about the plans individually. It doesn't offer that side-by-side comparison, but there are a lot more details on those documents. The Wellmark Health Compare tool, we're going to demonstrate that for you. It'll give you an estimate of your annual out-of-pocket costs if you were to go on to either of these two plans. So the first thing it's going to ask you to do is select your plan period. So we're going to say 2018. Then it's going to ask you if you're covering you or if your spouse is a UNI employee. So we'll say no, and we'll say that we're covering a single person for this example. Then it's going to ask you your typical number of doctor's visits per year. So we'll say we have 1 preventive office visit, 2 specialist office visits, 3 primary care, and 4 urgent care visits. Next, it will ask you for your prescription history. So we can say currently we're on 4 generic drugs. Once you hit submit, it's going to give you a side-by-side comparison and give you that estimated annual cost per the information that we entered. So at the top are the plans, the Alliance Select Blue or PPO and the Blue Advantage HMO. The networks are listed there, the deductibles, the copays for the office visits, and then the copays for the prescriptions. So you'll see that for the PPO plan, it's a $21 for single. You would have to take that times 12 and then add that to the $260 that it estimated for the annual cost to get the $512. On the Blue Advantage plan, it's 0 for a single premium. The out-of-pocket healthcare expenses were estimated at $170 to give you $175 total estimated annual cost. So this is just a good idea if you're not sure what you're going to end up spending, if you're moving to a new plan, or maybe you're considering moving from one plan to another. This can give you a general idea. This is also a good tool to use if you're considering electing or re-enrolling in the flex spending account. It can tell you about how much money you would be expected to pay out of pocket, and then that would help you maybe set your contribution limit for the flex spending. Back on our website, we have our Find a Doctor link. So that's what we'll demonstrate for you next, as it is a requirement on the Blue Advantage plan to list a doctor. So we will show you how you can find that specific doctor. So how would you like to search? We're going to say by my network, product, or plan name. And then you can say that you have one of the HMO products or plans listed here. It's going to ask you for a zip code of where you're looking and then the range of miles in which you want to look. So we're going to say Cedar Falls within 10 miles and that we are looking for a primary care provider. Once you hit next, it will bring up all of the primary care physicians in the area that we selected, so 10 miles within Cedar Falls. So as you can see that this person on the right-hand side, it says primary care provider, yes. So this would be someone qualified that you could list on your plan as a primary care physician. You can also search specifically by name. If you want to check your specific doctor, you can always enter their first and last name. If someone does not populate on this list, it means that they are not covered. So you want to make sure that when you search for them that they do appear. Under tools to help you use, we have several different tools that are available on our website at all time. So you may have noticed that we do have a taking ownership website now, and he's kind of become kind of our determined little icon and what we're using. So we are saying that all members of our plans can take ownership of our plans, and we have different tools and resources to help you do so. So under the chances you don't know column, there is the what does self-insured mean? So it has that video that we already viewed. You can always go out there and reference it again. And then the everyday benefit terms. So that's a more extensive glossary that you can look up anything at any time. The second section is the Healthy You, Healthy Plan, and these are different tools to help you save money while utilizing our plans. So the first link is Know Before You Go, which this link includes a compare or a cost estimator. So if you're wondering, I have to have this service done, I'm not really sure how much it's going to cost me. You can go out there and it will help you estimate what it will cost you on your plan. There's also information again about the savings that we receive, the university and the plan, as well as the person utilizing the plan receives when having services done within the state of Iowa, not utilizing the ER for non-emergencies, and then also the flu shot and biometric screening services that our well-being offers. Wait, do not fill your prescription yet. So this is a step-by-step guide of questions that you should consider when having a prescription filled. So it might be, is there a generic available? Do I need prior authorization for this prescription? So just another way that you can save a little bit of money and consider when filling a prescription. You have so many choices. Let us help you choose. So far today we've talked about office visits, doctor on demand, the virtual office visit, urgent cares, and the ER. So where's the best place to go to receive service for certain ailments? This page has a chart of many different ailments and then the best place that you could go to receive service for that condition or whatever you're experiencing. And then finally, Health Insurance Made Easy. This is a listing of different tools that you can use while on the plan. And one example of that would be My Wellmark. If you haven't registered for My Wellmark yet, I encourage you to do so. It is a handy tool that Wellmark provides to us. What you need to register is just that ID number on the front of your card. And once you register, you can go in and you can view any explanation of benefit that you had. You can choose to receive them electronically. You can print an ID card. You can request new or additional ID cards. Or like we talked about, that prescription and medical max out-of-pocket spend. It will calculate that for you and tell you where you're at and how much you've spent out of pocket for the year so far. So again, just a good tool to have or to reference if you need to. And then the third column is planning today for tomorrow, and those are our financial resources for our benefits, and Chelsea will go into those a little bit more when she presents on our financial benefits. And then there's the link to My Wellmark if you wanted to register for that. Are there any other questions on our health plans before we move forward to the dental plan? Yes?
Me and my wife both work here, so do we get two singles or we gotta go family?
No. So if you and your spouse both work here in benefits eligible positions and you're not covering anyone else, it would benefit you financially to do two singles rather than doing the shared family. That's a great question. Yes?
Do they still have the coverage? You have to cover your child till you're 26. Is that an option?
It's always an option to cover a child. It's completely up to you. But you can cover a child up until the age 26, and their coverage would then end at the end of the year in which they turn 26, so December 31st. You can continue coverage after the age of 26, but only if they are an unmarried full-time student or permanently disabled, at which you would then be required to provide proof of that to our office, such as proof of disability or a school schedule.
So you can take them off. I know they had a law saying you have to cover them until they're 26.
You don't have to until they're 26, but you are able to
Okay.
if you need
So I
to.
can take them off.
Yep, like if they're eligible for their own coverage, you're not required to keep them on there. So we don't monitor that. If you fit into that category where you do have a 26-year-old right now, and you need to continue coverage for them in January, you would be required to add them back this year. So something to keep in mind when you're enrolling or electing benefits. Yes.
So, if coverage is waived during this open enrollment period, my spouse actually has, we found better coverage that way. Is it something during the next open enrollment period that I could enroll at that point?
So if you waive coverage during this open enrollment period, could you decide to enroll next open enrollment? And yes, you can always make changes to your benefits, either to a qualified life event. And when I say that, it's like a marriage, a divorce, you're having a baby, maybe your spouse is gaining or losing coverage, or during open enrollment. And that doesn't just go for electing a plan. Maybe you elect one plan this year and the next year you want to give the other plan a try, you can definitely do so. Yes.
Will you need referrals from your primary care provider to use community care or urgent care, or will those be covered?
No, as long as you're within the network, you do not have to have a referral. Yes.
If a person had a condition where procedure was required that nobody did in Iowa and you were on the HMO plan, but somebody did, say at the Mayo Clinic or something, is that not covered at all?
So the question is referring to Mayo Clinic, and if you're on the Blue Advantage HMO plan, if no one else in the state of Iowa could handle your coverage or complete that service, if that would be covered. And we can't really answer that. Wellmark makes all final determinations of what is covered outside of Iowa on the Blue Advantage plan, but we've learned it's not very typical. But again, 100% of hospitals in Iowa are covered on the HMO plan, which would include University of Iowa, and then about 98% of physicians. So, any other questions about the two health plans? Okay, I will move on to the dental plan. We do have one dental plan that you're eligible to enroll in, and that is called the UNI Dental Plan 2. So for what's new for 2018 is that there have been plan design changes, which means that there has not been premium changes. It's just enhancements to the plan, so things that we've added to the plan for 2018. So added to the plan would be oral evaluations, including consultations, 2 and a benefit period, space maintainers, including re-cementing. Once every 5 years, you can have implants covered. And then 2 new programs being offered, enhanced benefits and the to-go program. And I'll tell you all about those in just a moment. But first I want to go over the dental plan itself. So again, here you can see our premiums are listed and they are in bold. So $6 for single, $54.75 for family, and then $46.50 for that shared family. There's a $1,500 annual benefit period maximum, and that goes for you and anyone else you're covering on the plan. There is no deductible per person or orthodontics deductible either. There is a $1,500 lifetime maximum for orthodontics, and orthodontics applies to anyone that is up to age 19 on your plan. Checkups and teeth cleaning, which is your 2 annual checkups and the teeth cleaning plus the x-rays, those are covered at 100%. Cavity repair and tooth extraction, so you can see the plus sign after number 1, emergency treatment. That's something that's new for 2018. On the right-hand side, I want you to take note that there are 2 different co-insurances listed. So depending on where you go see a dentist and what network they're associated with depends on the co-insurance that you would pay. So if your dentist is in the PPO network, you would pay 10%. If they're in the Premier network, they'd pay 20%. One thing I want to note is that this PPO network is completely separate than the PPO plan that we just talked about. So the health plan and the dental plan are separate. It doesn't mean that if you're on the PPO plan, you automatically get a lower coinsurance. That's not what that means. It just means that your dentist can be in one of these two networks, and if they're in that PPO network, you're going to pay less for this service, I should say. And then we included a flyer in your handouts that have a definition of those networks as well, and how you would determine where your dentist is and find out what network they're associated with. So root canals, that would be 40% coinsurance if you go to the PPO network, and then 50% coinsurance for Premier, and the same for gum and bone disease. High cost restorations, as well as dentures and bridges, it doesn't matter which network you're in, you would pay 50% coinsurance for those services. And orthodontics, straighter teeth is the same. It's a 50% coinsurance up to that lifetime maximum, no matter if you're in the PPO network or the Premier network. The two additional options for 2018, first I'll go into detail about the enhanced benefits, and you are also provided this handout as well. So if you have one of these conditions, either diabetes or maybe pregnancy, you could be qualified for extra teeth cleanings per year. So this program, this research has been done that it does not only benefit you with your dental health, but your overall health if you have additional teeth cleanings throughout the year. So typically only 2 teeth cleanings are covered, but for example, if you have diabetes, you would be qualified for an extra 2 teeth cleanings a year. This program does not cost you anything extra to take advantage of. It's part of your dental plan if you enroll. So if you want to take advantage of these extra teeth cleanings and you meet one of those conditions above, then you could go to deltadentalia.com and you take these steps and enroll select the member that the condition applies to. So if it's you, you can cover yourself or have that apply to you or a spouse or a child. Additionally, there is the to-go plan the to-go program that is new for 2018. So this is a rollover program of that annual benefit period maximum. So as we said, we have $1,500 on our dental plan too. This example goes, if you used $500, that would mean you would have $1,000 left for the year. That will now automatically roll over into the next year so that you immediately start the year with a $2,500 annual benefit maximum. So now it's increasing and allowing those who have a lot of dental work that needs to be done, you have a greater benefit. This is automatic. You don't have to sign up for this. And again, this program is no additional cost. It's automatic on our dental plan. The flyers that we just went over are right here on our website, as well as that PPO and Premier Network flyer. And then the Find a Dentist link is there as well if you want to either search for a new dentist to make sure that you're going in the PPO network, or maybe just find out which network your dentist falls into. Do you have any questions on the dental plan? Okay, so we will move on to vision. There have been no premium plan changes or plan design changes for vision. Everyone on campus who is benefits eligible were eligible for the same plans last year as they are this year, and they have not changed. Again, if you're enrolling in a self-insured health plan for the first time, you do have a routine eye exam covered on each of the plans, so something to keep in mind when you're considering vision. Our vision provider is Avisus, and they offer 2 plans to us, a materials only and an exam and materials. And those information are those first 2 links there under tools to help you choose. And then I also want to review with you the Delta Vision program, which is a discount program. So if you decide that you do not need the Avisus vision plans and you waive or opt out of those options, but you are in the dental plan, you can take advantage of the discount program offered through Delta Dental. And this would give you a discount on materials, certain materials at participating providers. The enrollment is automatic as long as you're in the dental plan, and there is no premium associated with this program. If you want to take advantage of this, on the first page of this flyer, you could print it out and cut out this card and keep that with you. And then as long as you visited and made a purchase at a participating provider, you present that card and you could receive your discounts. So this is an additional vision option for you. To find out who is a covered eye doctor through Avisus, the link is right here, as well as who is a participating provider of the Delta Vision discount program. Are there any questions on the vision offerings? Yes.
If you have vision right now, it automatically just goes off if you don't reach the sign up.
Correct. So the only plans that anyone has to take note of for 2018 or make an active change would be if your merit asks me and you're in health or dental and you want to enroll in a new health or dental plan. Vision, voluntary term life, your TDA, which we'll go over, that if we don't make any changes to that, that will remain the same for 2018. Flex spending, you have to make that re-enrollment each year.
So vision, you stay in. If you don't make any changes, vision just keeps on going up.
Well, what if you don't get rid of it?
Then you would go, then they'll explain how you can waive it.
Yeah, so if you want to opt out, you would have to actively opt out. And we'll show you the system for that here in a moment. Any other vision questions? Okay, yes.
Back to the actual network part, do you need a referral anytime you need to see somebody else, whether in-network?
No referrals for in-network, so as long as you're staying in-network, then you would not need that referral. Yep. Okay, so Chelsea Wickham will now present on our financial benefits.
Do they have to be next to each other? Okay. Perfect. Good morning. As Jesse said, my name is Chelsea Wickham. I'm the retirement planning coordinator here at UNI. I'm going to go over the financial benefits you guys have the opportunity of making changes to or enrolling into during your open enrollment period this year. The first item we'll talk about is flexible spending accounts. So I know Jesse had mentioned that you will be utilizing pre-tax deductions for health and dental. Along with that, you can also see additional savings by enrolling in a flexible spending account. For this year, the increase for the healthcare flexible spending account has gone up to $2,650. So what we're going to take a look at today under tools to help you choose, if you'd like to learn more on flexible spending accounts in more detail, we do have a web page out there for you. But we're actually going to take a look at how pre-tax deductions work and then how combining your flexible spending account with those can help maximize your savings and your take-home pay. So we're first going to look at this left-hand column. So this is after-tax deductions. So if you have opted to not utilize your pre-tax health and dental deductions or for this year, then this is how this would work. So your pay check in this example is $2,000. You do not have any deductions for your health or dental premiums before taxes. So the taxable amount on your paycheck is $2,000. Your taxes then are deducted from that amount along with your health and dental premiums. So your take-home pay after that equates to $1,380. On the right-hand side, though, we're going to show you how this works with your pre-tax deductions. So your paycheck is $2,000. In this example, though, you're taking advantage of that pre-tax savings. So those premiums are deducted before your taxes are withheld. So $120 is deducted from $2,000, meaning your taxable amount now is $1,880 compared to the $2,000 you had before. So your tax amounts are lessened, and you don't have any after-tax deductions because you've paid your premiums with pre-tax. So your take-home pay, in comparison, is increased to $1,410. Okay? Now let's look at how, if you combine a flexible spending account with that, how that will work. Your flexible spending account options here at UNI is you can sign up for a healthcare flexible spending account, which would cover medical expenses for yourself and your covered dependents, including a spouse. You also can sign up for a dependent care FSA that would help pay for daycare expenses for a child or day-to-day care expenses for an adult dependent. So we're going to first take a look at the left-hand side. So this is an annual basis, so this would be your yearly income. In this example is $45,000. You are not taking advantage of the flexible spending account, but you are taking advantage of your pre-tax deductions for your health and dental premiums. So your taxable amount is right here at the $40,213.80. So we deduct taxes from that amount, which equates to $28,994.15. But then we're going to have to subtract all the money that you spent after taxes on, for example, prescription drugs. Maybe your eyeglasses or contact lenses, or braces if you have somebody that has orthodontics. So your annual take-home pay after all of those reductions is $26,394.15. On the right-hand side, though, we're showing how, enrolling in an FSA saves you more. So you have the $45,000. You've elected for 2018 to set aside $2,600 in a flexible spending account. You've also have your pre-tax deductions for your health and dental. So the amount that your taxes is based on is reduced to $37,613.80. So again, we reduce from your taxes, and this equates to a take-home pay increase to $27,119.55. Okay. One thing to keep in mind with the flexible spending account, I know in this example we use $2,600, but on our website we have a savings calculator out here for you. What you'll want to take into consideration is how much you're actually going to spend out of pocket. So the tool Jesse showed you, the Wellmark comparison, that showed you out-of-pocket expenses. That's a good tool. You may use this savings calculator, or you may average your out-of-pocket expenses for the last 3 years for healthcare and or dependent care. The reason you'll want to do that is the amount that if you don't use the amount that you elect, you will lose it. Okay? So one thing to keep in mind, though, is you can spend that on eligible expenses. So we have a list out here for you for both health care and dependent care. We also have an FSA online store. And so any purchases you make through this online store are all eligible expenses. So say at the end of the year you have $100 left in your flexible spending account. You can go out here and purchase sunscreen, Band-Aids, things of that nature, and it's all eligible. So you can still go to your local stores and purchase eligible items, but out here everything is, so you don't have to make that determination there. When you submit a claim to have your reimbursement, all that money is returned back to you tax-free as well. So if you're submitting for $50, you will get $50 back. And how you can submit those claims is you can do that on your phone if you'd prefer. You can send in a paper claim form. Or if you sign up for the flexible spending account for healthcare, you are able to enroll into a debit card. There is a $12 annual fee that will be deducted from your flexible spending account for that. So any questions on the flexible spending accounts or how pre-tax premiums will work for your health and dental? All right.
Is there a minimum amount
For
flexible spending account?
a minimum amount for your flexible spending account,
$20.
$20. So it'd be over a 12 pay, it would be $240. Any other questions? Sorry, this keeps cutting out, I apologize. All right, we'll move on to our next way to help you plan for tomorrow is we do offer additional voluntary term life insurance. There are no changes to your group term life insurance that UNI provides you for 2018. You do have the capability of purchasing more insurance though, if you would like to have that to cover any gaps. Experts recommend to have about 7 to 10 years of income set aside in a life insurance policy. So if you're interested in increasing that policy for yourself, you may definitely elect voluntary term life insurance. One advantage is you may increase your coverage each year from $10,000 to $20,000 without completing a proof of good health questionnaire. So we do have a life insurance calculator out here for you, which is over under tools to help you choose. And then we do also, under the benefits at a glance, that's where you can find your rates. So if we take a look out here, you can purchase voluntary term life insurance for yourself, and then once you have that for yourself, you may elect to have that for your spouse or child. And it does go by age, and this is per $10,000 for coverage is the example for the employee, $5,000 for the spouse, and then for a child is $2. Another good item just to, as a reminder, is to go out and look at your beneficiary information we have on file for you. This is for life insurance only. So when you go into self-service, make sure to view your beneficiary information and make any applicable changes if you need to at that time. If you need to update beneficiary information for TIAA or IPERS, you will need to go to each of those companies respectively to do so. Okay. Any questions on voluntary term life insurance? All right. Lastly, we all want you to prepare for retirement. So what's new for 2018 is your tax-deferred annuity plan limit has increased to $18,500. So if you'd like to contribute more into your retirement plan, you're able to do so through what's called a tax-deferred annuity. We also refer to it as a TDA. You may have previously, if you're participating or have participated in the past, it was referred to as an SRA. So these are the same things. The smallest amount contributed can make a large impact on your retirement savings. So we're going to take a look at how that works. If you'd like to see the vendors and learn more information, we have our website out there. But some questions after you review your retirement plan with TIAA or IPERS, you may think, oh, I might be falling short of my retirement goals, or I want to contribute more, I just don't know how. Or if you'd like to see additional savings on your taxes now or at retirement, this is a good vehicle for you. So the tax-deferred annuity, you have the option of doing the pre-tax contributions, similar to your pre-tax deductions for your health and dental. You also have the option with TIAA to do an after-tax contribution called a Roth TDA. So your deduction will be held after taxes. So that means you've already paid taxes on that money, so when you withdraw that at retirement, you will not have any tax penalties at that time, if you choose that route. So we're going to look at how even the smallest amounts can help you save more for retirement. In our example out here, we'll take a look at the $25 column. And so we're assuming a 6% rate of return that you've invested that into a tax-deferred annuity. After 5 years, that $25 has the potential to have grown to $1,746. We're going to compare that to if you just put that $25 into a shoebox or under your mattress, wherever that may be, but it wouldn't have a rate of return associated with it. And after 5 years, the amount is at $1,500. Now let's say you keep that money in your account for 30 years, and you're continuing to contribute each month that $25. You have the potential to have that grow to $24,481, where when you keep that in your shoebox without that rate of return after 30 years, it grows to $9,000. So as you can see, even small amounts can help you save more for retirement. And if you are interested in signing up for the tax-deferred annuity, you're able to do so during this open enrollment period or anytime throughout the year. Any questions on those accounts or how to save more for retirement? All right. Well, as a reminder, when you're making elections, Mayor asked the employees you must enroll into a health or dental plan if you want to continue coverage here at UNI. If you're covering an overage dependent, so a qualified child over the age of 26, who is either an unmarried full-time student or permanently disabled, you must log into self-service and add them back to your plan and then fill out the corresponding qualifying questions. If you want to contribute in a flexible spending account, you do need to enroll each year, so make sure to do that under self-service as well. And we've been mentioning self-service a lot, so new for 2018, UNI Human Resource Services will no longer accept paper forms for benefit changes and or updates. So we're going to take some time to show you the video of how you will move forward with electing your benefits.
Hi. Get ready, Employee Benefits Open Enrollment for the University of Northern Iowa is here. This is your opportunity to review your benefits and enroll or make changes. Open enrollment runs from November 1st through November 30th, and all changes are effective January 1st of 2018. New for 2018, the University of Northern Iowa now has a web-based benefit self-service system. This is a comprehensive system, making managing your benefits easier than ever. This system will allow you to make changes to your benefits, enroll, Upload important documents. Check the status of your request. And much more. Start by visiting the Open Enrollment website at hrs.uni.edu/OE. Scroll down the web page and locate the Benefits Self-Service Login button. Click once on the button to access the secure system. At the login page, type in your University CAT ID, password, and then click on the Login button. A simple menu of options will appear, giving you quick access to view and update your benefits. Open enrollment is now effortless. All you need to do is click the Manage My Benefits button. Next, indicate the life event or reason for changing your benefits. For open enrollment, select the first option. Then scroll down the page. In the month change takes place text field, type in the abbreviation for January, then type -2018. Click Continue. Based on the life event selected, the system displays all the benefits you are able to manage. Scroll down to view each benefit. You can also click the View Plan Details link within each benefit to learn more. Start making changes by clicking on the Change This Benefit button. Now, all your plan options appear on a single page, allowing you to easily compare plans, select a different plan or option, or add, update, and remove dependents from your plan. The layout is designed like other shopping comparison tools so that you can make the right decisions for you and your family. At the bottom, it will display your current enrolled option. Making a change is as simple as clicking the Select button. On the same page, the system lists who is currently covered. If making a change, be prepared to share information about your dependents. Need to add? Click the Add Dependent button. Need to update? Click the pencil icon. Need to remove a dependent? Click the trash can. Carefully read the authorization and certification section before clicking the I agree checkbox. Click the Save Changes button to save. The changes you made will show on the summary page, including new premiums and dependents. Read each thoroughly and verify your changes before moving to a new benefit. What else can you do besides making changes to health, dental, and vision? Enroll in a healthcare or dependent care flexible spending account. Enroll in a tax-deferred annuity. Investing in an annuity is a great way to save more for retirement. Elect additional term life insurance for you, your spouse, and your children. Using the system to enroll in a flexible spending account is quick and easy. Enter the desired contribution amount, and watch as the monthly payroll deductions are calculated. Add the amount for additional voluntary term life coverage. The system is designed to prevent incorrect amounts. Once you made all the desired changes, read the life event authorization and certification carefully. Click I agree to electronically sign your permission for the requested changes to your benefits. Click the Submit button. The benefit self-service system is fast and user-friendly. Best of all, it is available from any smartphone, tablet, or computer with an internet connection, so you can manage your benefits day or night, whether you are at home, at a friend's house, or at work. Visit the website to get started.
All right, so this video will remain out here on our open enrollment webpage, so you can view that at any time. In the mailings that we sent home, we did send a quick reference guide as well for you on a sheet of paper. So we encourage you to go out and start using our self-service system. If you have any questions or need additional assistance, we will have computer lab session times next week, Monday through Friday, and then continuing on Monday, November 20th. So if you do want to come to a walk-in session, registration's not required. You're more than welcome to come at any of those times. If you have questions for us after today's session, on all of our web pages, at the bottom is the Contact the Benefits Team button. Please feel free to send us a message through there, and a member of our team will respond to you right away. So does anyone have any other questions for Jesse or I today? All right, well, ourselves as well as members from our benefits team will be here to answer any individual questions you have after our session today, and we do want to thank you for your time. Have a great day.